Hello, I'm Rob McNeely, and it's a great pleasure for me to be having a conversation today with Roxanna Erickson-Klein. Roxanna, thank you for being willing to be part of this series and your generosity and your time, giving your time and your sharing your experience. Really welcome.
Well, I'm delighted. I'm delighted to be here with you, and it's exciting to be able to talk to you, particularly halfway around the world. It has a great feel to it.
Yes. So to begin with, perhaps, could you say something about your background? How come you are doing what you're doing? Tell us something about what you're doing and what's led you to that.
Okay. I guess I'll start with where I was born. I was born into a family, the Erickson family, the seventh of 8 children of Milton and Elizabeth Erickson. And so I grew up in a household where hypnosis was part of our daily activities and daily orientation in life. It's a large family, and a lot of us are in the health professions. And I grew up to be a registered nurse and went to nursing school, was very happily engaged in nursing for a very long time. And then recently, I decided to go back to school and get a license in counseling. So at this time, I have licenses both in nursing and in clinical counseling, and that I also have training as a substance abuse counselor, which here is a separate license. So I came from a medically oriented background that was strong, with emphasis on using hypnosis and integrating hypnosis into the medical field. And I have continued to do that in my roles as a nurse and also as a counselor, and now in substance abuse. So that's, in a nutshell, that's my background.
Yeah, that's great. Thank you. And it's not surprising then, if you're in such a family with that orientation, that you can't help but absorb some of that, some of the mood of that, some of the expectations of that, and some of the experience of that. So, do you have some comments there?
Yeah, it's interesting. It seemed during our formative years, our growing up years, it seemed like there was not many demands placed on us to learn about hypnosis in a educational type of way, but the door was open to us. And we could observe that Dad was doing his work and took it very seriously, and that he was well known in hypnosis. And we could see that people were coming to study with him from all around the world. And he had some very specific things that we were required to learn from a very young age. We were expected to know that when you see cartoons and you see Bugs Bunny hypnotizing someone else, that this is stage hypnosis and it is not an accurate representation. Mm-hmm. So we were required, even as small children, to be able to identify that that was not accurate. And because we needed to know that, of course, we needed to know a little bit more. But if we weren't interested, he just would wait until we were. Mm-hmm. And when we were interested, he was very forthcoming in giving us information to quench our thirst, and then just to let it be. So my different siblings, some of us were quite interested and quite curious and quite wanting to get involved, and other members of the family were really not that interested, but they learned what they needed to learn. But as I've gotten to be a professional in the field, and as I've gotten more of a broader framework, I can see that even my siblings, who didn't seem to have that much interest, have absorbed a tremendous degree of knowledge. And specifically, but let me give you an example because it really struck me when it happened, was I had the opportunity, one of my brothers, my youngest brother, Robert, who's 4 years older than me, he grew up to be an English teacher and worked his career teaching English at high school level. And he was never particularly interested in the healthcare delivery field. And he learned about hypnosis, but he didn't pursue it on a professional level at all. And I had the opportunity to visit a family friend with him together, he and I. And as I saw Robert, with no professional training whatsoever, interact with such finesse and such hypnotic suggestion, that I was totally blown away, because I had never perceived him as having tried to learn those skills on a professional level. But he was as smooth in his delivery as any trained professional that I have seen.
Lovely. Yeah, that's so lovely. And you probably know that I got to know Alan quite well when he was living in Australia for a number of years. And when he first came to Australia with Luann and their 3 daughters, we took them to a part of the country near Melbourne, thinking that they would enjoy that. And on the way back, the girls were sitting in the back of the car and the sun was getting in their eyes. And one of them said, "Dad, the sun is getting in my eyes." And Alan, as cool as anything, just said, "Oh, would you like me to shift the sun?" And there was no further comment after that. So, could you say something then from, you hinted at it already, and it's in a way it's probably so transparent to you, but what could you say that, from your experience, that hypnosis in general brings to the therapeutic process? What benefit do people using hypnosis in general bring to their practice, and what benefit could someone wanting to learn this, what could they expect to be a benefit from an exposure, from learning the hypnotic approach?
Well, to me, the use of hypnosis is integral to all effective healthcare. Whether or not you're a trained professional hypnotherapist, if you are an effective healthcare provider who is clinically attuned and engaged as a deliverer of healthcare, in all probability, you're using hypnotic techniques and hypnotic strategies, whether or not you are fully aware of that.
Mm-hmm.
So to study hypnosis brings a higher level of awareness of not only what you're already doing, but of the potential of what you can do and how you can move individuals in the direction of health and well-being.
Mm-hmm.
So familiarity with what is hypnosis, what we hope to get out of it, what we're thinking we are able to achieve with it, and then to implement that in a conscious way adds to our effectiveness as caregivers and care providers.
Yeah. Mm. And could you make any specific examples of that in your nursing or in your substance abuse work?
Well, let me start. Most of my career has been in nursing, and I'm now transitioning over to substance abuse. But let me start with pain management. And of course, as as a nurse in the hospital working with patients or in home care is I've worked in the hospital and in hospice home care for a number of years. You're working with patients who are in pain, and lots of times taking pain medication and not getting adequate relief, or wanting to take less, or not getting the full benefit from the pain medication. I don't advocate using hypnosis instead of pain management, medicines. I advocate using it as an adjunct and then adjusting it to the needs and situation of the patient that you're working with. Mm-hmm. Well, one example of where it works very effectively is with phantom limb pain, which is a very difficult to treat condition for post-amputees. When you get people who have an amputated limb, either because they've had some traumatic injury or because they've had some disease process that robbed them of their limb, there's often quite significant pain associated with the absent limb, and it tends to be rather difficult to achieve levels of comfort with medication. And I think that most nurses, if I won't go so far as to say all, but most nurses who work with this population, when they see a patient who's crying in pain, they know to go to approach the patient at the bedside and to inquire what they need, what they think might help, and to elicit that information in a very hypnotic way. And many, many times, what the patient wants is to reposition their missing limb. Mm-hmm. Because there's something about the pathology of phantom limb pain that gives them the sense that their leg is still there and is bent in an uncomfortable position, and they want to reposition. Mm. And so most nurses, and I have seen nurses with no training in hypnosis, I have seen home health aides, I have seen people of all walks of the healthcare professions go to the bedside, speak softly and gently, speak with the expectation that this pain can be lessened, and then to go through the gestures of picking up the limb and moving it, and this is all, positive hallucination, picking up the limb, repositioning it, soothing them, settling the sheath, and speaking softly in a way that elicits from the patient a hypnotic response. And that is one of the most effective techniques for dealing with this very difficult to treat pain. And it isn't unique, it's a hypnotic technique. Mm. The nurses know how to do that in service of treating a patient who's suffering severe pain. Mm-hmm. Of course, they're also looking at what pain medications are on board, and can anything else be added to that list, and is it going to help if I can stand here and hold their hand and listen to them, or is there something else that we can do? Mm-hmm. There's other techniques like distracting, putting on music and stuff like that. Mm-hmm. But that gesture of supporting a positive hallucination, mm-hmm. and supporting the patient's illusion of repositioning in a more comfortable position is so effective that any long-term nurse working with that population already knows how to do it.
Beautiful. Such a in a way, a simple step.
Yes.
So lovely. I remember your father speaking about a friend of his who had if I remember rightly, some years ago, a wooden leg. And whenever this man, I think he was a professional, whenever he was trying to work through a problem, he would bend down and scratch his wooden ankle and got a lot of satisfaction from that. And I remember being intrigued at the time. And, you know, so often we forget that just because someone is having having an experience, it doesn't have to be stuck with that. It doesn't have to be limited. There are things that we can do. I loved hearing what you were saying about repositioning. I have not heard that before, and other people may already know that, but it's such a beautifully elegant and respectful intervention. That's just so marvelous. Thank you. Lovely.
Right. It's starting with eliciting what does the patient need, you know, accepting their worldview, working within that frame of reference, and it's so benign. There's no downside to that. Absolutely no downside.
So that's just beautiful. And to add further to this idea, could you say something? You've spoken about hypnosis in general, and by shifting someone's attention and shifting their focus, allowing an alteration in their experience. But what do you think are the additional benefits for clients, for therapists, to learn about the Ericksonian approach in particular?
Well, I start from a position where my frame of reference is Ericksonian, so I'm a little biased. But when you look at what distinguishes the Ericksonian from other psychotherapeutic approaches, there's a few things that really make Ericksonian approaches distinct. Mm-hmm. And I think that's one of the reasons why we really need to challenge ourselves to get Ericksonian approaches more widely known in the university system, is so that people will have a frame of reference for what is Ericksonian. Yep. But one of the key features is the notion that the unconscious mind holds within it the information that we need to help guide us in the direction of health and well-being. The Ericksonian approaches believe in a natural tendency towards health, and to access the unconscious mind, which is Ericksonian strategy, to access the unconscious mind to mobilize existent resources in the direction of health it makes so much common sense, and so much it's so reasonable and so rational that it hardly seems reasonable to go in any other direction. Now, probably, at least from what I've observed, the biggest difference, there's two big differences between Ericksonian approaches and more traditional approaches. And one of them is the viewpoint of what is the unconscious mind. And then the other is in the necessity to have insight or cognitive awareness in order to bring about problem resolution. Now, the Ericksonian perspective is that every person, every man every woman, every child has a conscious mind and an unconscious mind. And that the conscious mind is sitting here, and it's the one, me talking, wearing the headphones and looking into the camera and speaking to you. That's the conscious awareness. But at the same time, there's an unconscious awareness that is a repository of all of my life learnings, everything that I've learned from day one, and all those resources that when I have troubles, when I have problems, when I have things that aren't working out for me, the unconscious mind is entrusted with trying to find resolutions to those problems. And that's part of the natural drive in the direction of health, that the unconscious mind is is seeking answers. And so the Ericksonian perspective is that the unconscious mind is ready and waiting to do this work. It is not a task that can necessarily be achieved through the conscious awareness. Other approaches to psychotherapy depend more heavily on the conscious awareness. It's bringing understanding to our thoughts, feelings, and behaviors. It's bringing insight as to, I have this problem because of something that happened to me. But from a more pure Ericksonian perspective, at least my interpretation of it, the unconscious mind will continue to work with or without conscious awareness. It is continuing to seek information to help one go in the direction of harmony and balance and internal well-being. So to try to put effort in the direction of understanding your problem, bringing it to cognitive awareness, to develop some insight, is energy that may be helpful, but it may not be helpful. And when you begin to study the fallibility of memory and how memory is not fully accurate, that to try to pursue understanding of why behavior is and then to develop insight may or may not be accurate. Mm-hmm. But Erickson believed that it was not an essential part of the healing process to gain this cognitive awareness. His perspective was that you trust your unconscious mind to develop the understanding that it needs.
Yes, and I remember a quote of Woody Allen who said he'd been in analysis for 12 years. He's going to give it one more year, and if that doesn't work, he's going to Lourdes. So he had a way of putting things. And there's something to me that about this approach, people say it's positive, and I prefer to think that it focuses on possibilities rather than just being positive. But when we're working towards possibilities, it has an effect on us as the therapist. I like to say that if you're working in a fish market, sooner or later you'll start to smell of fish. And if we're working in possibilities, obviously, from what you're saying, this is going to be much more relevant to many clients, many people. But also there is a benefit for us.
Absolutely. Absolutely. And it goes beyond the just seeing the possibilities and thinking about the possibilities. When someone comes to you and they're stuck with some sort of a problem or some sort of a discomfort or something that isn't working well in their life, and we as therapists with Ericksonian perspective, we're doing more than just reflecting on the problem and hoping that it will evolve. We're considering a variety of possibilities and perhaps bringing those to the attention of who we're working with, either in a direct way or possibly in an indirect way. But we're open to our minds to what are the possibilities here. And so that's exercising that skill within us. The more that we work, the more that we're exercising that part of our thinking. And in addition to that, as we see positive outcomes, then we have the added benefit of the vicarious experience of the mirror neurons of seeing that, oh yes, that did seem to have a positive benefit in going in that direction, even if you can't understand it on a cognitive level. And getting back to the example of repositioning the phantom limb pain patient's leg, on a cognitive level, that doesn't make any sense whatsoever. but the possibilities are that something was activated, and the more you begin to read about neurobiology and the more we're discovering on that horizon, it's beginning to show evidence that those centers in the brain that would be associated with the limb, when you go through those gestures and treat it as if this is real, on some level there is some brain activity that supports it as real, and so some readjustment does get made within the unconscious mind on levels that we don't fully understand.
Yes. Yes, in some ways your father was about 50 years ahead of his time. You know, he was speaking about these things. You know, Einstein spoke in the early 1900s about relativity and so on, and 50 years later there was a technology to verify his ideas. And I think the brain science that's become so popular recently is in some ways providing evidence for what your father was talking about and knew intuitively through his own experience all those years ago.
I agree 100%, and that's one of the things that's so tremendously rewarding, is to see that yes, this does support his ideas. It does support his treatment approaches that seem to be so unexplainable or so crazy at the time, that he went in a direction that he believed was most likely to help the patient, regardless of whatever criticism he received. He was a very ethical person. He maintained really strong ethical commitment, and yet he did activities like involve family members in working with patients in their rehabilitation. We got to know many of the patients when they came in to see him, and that was compounded by the fact that the office was in the home. But he supported us being friends with the patients, and that's still not, in today's world, that is not considered to be ethical. It's not considered to be good boundaries. But if you stick directly with what is in the best interest of the patient, what advances the patient in a direction of rapid recovery to health, there's no question that definitely helped the patient. And we still have the patients hanging around. My father's been dead for over 30 years, and we still have patients who communicate with us and tell us how much it meant to them. I spoke with somebody on the phone yesterday who spoke that I had climbed Squaw Peak, which was one of Dad's homework assignments. I had climbed Squaw Peak with him, and he called me yesterday. I haven't talked to him in about 5 or 10 years. He called me on the phone to tell me he'd been thinking about that climb to Squaw Peak, and it was one of the most life-changing, meaningful events of his life, and he wanted to share that with me. And that is a not uncommon thing to come my way, for a comment like that.
Yes. Yes. Yep. Yes. Ethics is a rather emotionally charged word, and to me there are different levels. Often people talk about ethics as like with the ethics committee. In other words, if you do, there are minimal standards, otherwise you get thrown out of the club. But to me there is a higher ethic, which is precisely what you're saying, that to put our limitations aside and do what's going to be best for the client. To me, that's a higher ethic, and one that I'm aspire to myself, and grateful to have been introduced to that with the time I spent with your father.
Well, and Dad practiced like a country doctor, which was the era that he was educated in. And he maintained that country doctor approach where if somebody's going to pay you with a bag of pecans, that was fine with him, no questions asked. And if a patient had no family to go for a holiday, well, come on over, we've got a big family. That was how he practiced with that informal country doctor approach. And I'm sorry to say that in today's world, I can't do that. I feel that because of ethics has gone so strongly that they've almost lost sight of the benefit to the patient. So it's a difficult line, as you say, and it's emotionally charged. But today I want to protect my license.
Okay, yes.
So that I can continue to work with other patients.
Boy, yes. And touch is another area that's very fraught these days. I mean, when we do catalepsy or help someone with arm levitation, you know, that mammalian, that human touch. I mean, in nursing, you hold someone's hand, but as a therapist, oh my goodness, you know, you mustn't touch someone. Oh dear me. Oh, it's crazy. But anyhow, like you say, if you want to keep your license, there are some rules that you have to stick by. We were talking before about how, and Michael Yapko and Jeff Zeig have both spoken about the importance of bringing an awareness of hypnosis and experience of hypnosis into undergraduate academic programs. So could you say something about your experience of how evidence or examples that you know of bringing hypnosis training or experience into different academic settings?
Yes, and actually, since I went back to school relatively recently, it was about 5 years ago that I went back to get my master's degree in counseling. I was educated. I went kind of incognito with my name Klein. Quickly became apparent that I knew more about hypnosis than most of the professors. The theoretical foundations that they use do not typically include Erickson or just light touch with hypnosis. I think this is partly because the way Dad wrote and the way he defined his techniques as theoretical, I think it made it a problematic with the fit with the university structure and format. And so you get the textbooks that are able to, you know, look at the structure in a concrete way that's not quite so available with Ericksonian approaches. And so it isn't mainstream at least in the United States. In today's world, Ericksonian approaches is still not mainstream on the university level. It is getting its foot in the door now that neuroplasticity has become recognized as being the way the change happens, as opposed to the previous paradigm of insight. So with that shift, that paradigm shift of how change happens, it has opened the door wide open again for Ericksonian approaches to become more recognized. Now, the way that Ericksonian approaches has been recognized as in his leadership in training and working with clinical hypnosis. And there's been that recognition that hypnosis is a tool that does have a place in university programs, but it's not part of the core curriculum. It's part of the elective curriculum. So one of the things that Michael Yapko did, and I'm very grateful to him for having done so, is that he wrote this textbook, which is now, I think it's called Transwork. It's probably the most widely used textbook on clinical hypnosis in the world, and it's targeted at a graduate student audience. And so that has brought a great deal of awareness of the power and value of hypnosis towards healing. There's been others who have contributed. Steve Langton has done quite a bit of work to try to get this into the broader arena. And, of course, Ernest Rossi has been working with me to amass the collected works so that we have the primary works of Milton Erickson available to readers who want to read the primary works. And then, of course, Jeff Zeig has been teaching around the world, raising the level of awareness, and his influence is as important internationally as anyone's work. So, so we're kind of all working hand in hand, doing our part to raise the level of awareness so that the average clinician who starts without the advantage of having had the knowledge and experience of hypnosis goes through a regular program, an accredited program, comes out with at least a passing awareness of Erickson's name and of the value of hypnosis.
A couple of other people in this interview series are professors teaching hypnosis in academia. Eric Greenleaf and Douglas Flemons. They're two that I know just in isolation, but as you say, it's still not mainstream. But let's hope that you say the door's open. Would be wonderful to have the floodgates open, and we could have a flood of stream of interest in this work.
Right.
It's so kind of common sense. It's so it always seemed weird to me that thousands and millions of people don't want to learn about it. It seems self-evident that we would all benefit from this. But like you, in a different way. I'm very prejudiced, but yeah.
Well, so am I. But I think that as we are amassing more and more evidence about the neurobiology and about neuroplasticity, I think that it will become more and more recognized as a tool that can help you accelerate change in patients. And so I feel that this is a great time to be working in the field and watching the changes, the recognition come about.
Yes, that's lovely. I mean, I guess Jay Haley was probably one of the earliest people who put your father's name, made him, alerted people to what he was about. And as you say, with Jeff Zeig and all the congresses that he's organised, there's again another massive increased exposure for people. But the neuroplasticity, that's again another whole arena that's opening. It seems, I must be a dinosaur, a troglodyte or something. To me it's like, oh, we've got a brain. How interesting. But it's like that old Irish joke that said when the Irishman first saw the steam train, he said, I can see it works in practice, but does it work in theory? And at least with the brain plasticity and the interest in the brain, there is some evidence that the steam train can work in theory. So I guess right. I have to just kind of swallow my pride and try and catch up with what the world is doing with that. Could you say something also? You spoke before about a couple of other areas that you said that Latin America is showing some particular interest, and also Alex's film.
Yes. Well, let me start with Alex Vesley's film, The Wizard of the Desert. Alex Vesley is, he's the grandson of Viktor Frankl. And Viktor Frankl's work is it's had kind of a similar influence on the world of psychotherapy that Erickson had. It's not like Erickson, Frankl did not write his theoretical approach in the concrete, systematic way that made it an easy fit with the college textbooks. And so when you look at the 12 core approaches that they commonly teach, They do not include Viktor Frankl or Milton Erickson. And yet, both Frankl and Erickson had tremendous impacts in the way that psychotherapy is practiced around the world. And interestingly, there has been kind of a similar outgrowth of institutes. So there are logotherapy institutes that study the work of Viktor Frankl in the same way that there's Erickson institutes that promote the work of Milton Erickson. So there's been this parallel growth, which has a lot of similarities. So Alex Vesely had, in addition to a lot of their ideology was quite similar in ways. So Alex started by making a film called Victor and I. There was a documentary about Viktor Frankl, his work, and he won some significant awards for that movie that he made. And his second film is the one about Milton Erickson called The Wizard of the Desert. And that movie is in the final stages right now. And he's reaching towards a broader audience than just a professional audience, with the idea that he wants to bring the work of Erickson and the importance of hypnosis as a therapeutic tool out to a broad audience. So that video is coming along at this time, and I think in the next maybe five months it's going to be completed. But he's been working on it now for about 4 years, interviewed quite a number of people, and is currently in the editing phases. But that I'm very optimistic, because as I said, I think it's going to reach out to a broad audience, and the time is right. The time is right for that. I feel really good about that. And the other aspect of spreading the word and reaching out to a broad audience is that in Latin America, in Mexico and Brazil specifically, there has been recent movement to get Ericksonian approaches accepted in the accredited university system. And so there has been dedicated professionals who have given of their time and commitment to follow through getting the acceptance in there. And so that is really exciting, because when you have the recognition on the university level, you're opening the doors to a younger audience, which I think will help in a multitude of ways. So that's another thing that's very, very exciting to see.
Yes, it'd be wonderful if the future Ericksonian congresses didn't have to have too much emphasis on wheelchair access. You know, that for us, all of us older, you know, needing walking frames and so on, just so that it'd be great to have some young people there to help us along the way. But that's lovely that Teresa Robles, of course, and Marilia Baker, the heroes in letting more people know about that. And they're not the only ones, but they're two of the heroes that I know of.
There's a lot of heroes, and that's one of the exciting things about the Ericksonian approaches, is that there are a group, a cadre of leaders whose names we're familiar with, including the people that you've interviewed for this program. There is a kind of a core group of names that people are familiar with, but there are people all over the world that have dedicated their careers to promote this work, because they've been able to see that it's effective. And the work of each one is vitally important in their area. This radio show that you're doing, this interview, is exceedingly important in terms of reaching out to outreach. And if you look specifically at different countries, you'll see that people become familiar with what the needs are in their corner of the world and then pursue it. And I live in Dallas, and my little corner of the world is to have a local hypnosis professional organization, and that's my little backyard and corner of the world, and I'm doing my part to spread the word and bring the information to the people who are working treating patients, because they're the ultimate beneficiaries.
Yes, I mean, one of the marvelous things about the Ericksonian approach is honoring the individuality of each unique human being. But on the other hand, there's a dilemma. It's a bit like herding chickens to try and get people who are going to be individuals to be together. I mean, you know, the anarchist society only managed to have one meeting, and to have such a diverse group of people who are so passionate about honoring individuality, there is the dilemma of how do you get them in the same room?
Well, Jeff has done excellent work with putting
true.
on the congresses, the Ericksonian congresses.
Yes, indeed.
So, and that makes it very, very positive in the next week. It's exciting to see all different Ericksonians practicing in different ways, but still honoring the core concepts of trusting the unconscious wisdom to help you find those directions towards help.
Yes, that's lovely. And I wonder if you could also say something then. What's your experience personally and in the interactions you've had with many of these people? If someone wanted to learn how to include the Ericksonian approach in their therapeutic work, if they wanted to learn more about this, what hints could you give people? What's your experience about what's going to be useful for them to actually become more practically, experientially familiar with this approach?
Well, in the United States, I always encourage newcomers to go to the American Society of Clinical Hypnosis or the Society for Clinical and Educational Hypnosis Training or the Erickson Foundation. Those are 3 quality-controlled, solid programs where you can learn. Of course, with hypnosis, there's always that risk that there are some training programs out there that aren't quality controlled. So there are some training approaches that aren't quite as solid or as certain as that. But I encourage people to get experiential live training from a good source, and then once you have training, to begin to, at least a baseline of training, to begin to explore the possibilities with whoever you're working with, and to keep your mind open. One of the students in our study group defines hypnosis, because one of the problems with hypnosis is there's no fully agreed upon definition. So we each write our own definition, and I think that writing your own definition and coming back to look at it and modifying it as needed, that was one of the exercises that Erickson did. He didn't keep the same definition for year after year. He adjusted his thinking, he refined his thinking as he went along. So one of the students in our study group defined it for him as suspended disbelief. And I thought, wow, that's a good one. Suspended disbelief. I can get into that. If you start there as a student and accept, I'm going to suspend disbelief, it opens up all sorts of possibilities. We have a surgeon that has visited our study group a number of times, and his definition is believed in imagination. Okay, this is not my definition of hypnosis, but it's a respectable definition of hypnosis, and it's a definition that works for him, and he is able to support his efficacy with photographs. He works at a hospital, and he gets called in for surgical cases, and he's quick with the camera and shows the before and afters and uses it for training purposes. His name is Dabney Ewan, and it's really an effective teaching tool. So to me, the important thing is to get some solid basic training, to try to get a peer group that you can communicate with and bounce your ideas back and forth with to raise your level of sophistication, and then to get ongoing training and ongoing training. Now, of course, all the while that you're doing that, there's a lot of good written references out there, and including the collected works of Milton Erickson, although they're a little bit difficult to read. But there is a lot of good works out there, whatever your level of understanding, that you can start and move on. Now, when I have a new student that has a totally unfamiliar with Erickson's work and wants to learn more about it, Sydney Rose's book, My Voice Will Go With You, is very readable and very easy to understand. As likewise, Jay Haley's book, Uncommon Therapy, is a good springboard to begin to get a solid footing in that direction. But I believe that ongoing communication, ongoing training is integral to effective hypnotic work.
Yeah. Yes, it's a lifelong process. Eh? I think the day that we stop learning, well, we might as well stop breathing, I think.
That's right.
Okay, now we've spoken about a number of things, about your background and how come you find yourself doing what you're doing and continuing to do what you're going to be doing. Speaking about the benefits of hypnosis and Ericksonian hypnosis in particular, and how someone might learn about how to include that in their work. If you look back to our conversation so far, is there anything else that you might want to add that we haven't touched on, or anything that you might want to emphasize that we have spoken about?
Well, I think the one part that I want to emphasize is that is the ongoing learning, and here I'm in my 60s. I've been practicing hypnosis as a health professional for 40 years, and I'm still reaching out into new directions, to try new things, to explore new possibilities, to connect the information of what I'm seeing and what I'm working with, to learn new skills, and that is very, very rewarding to see the growth, the results that come about from that, and it's very rewarding to me. It puts me in a better state of health and a better state of keeps my brain young, and I think that that's one of the secondary benefits to getting involved with this. But I think that hypnosis, of all the psychotherapeutic tools that are out there, I think it is the most flexible. I think it is the most congruent with the neuroplasticity model of change. And I think that we are about to see a major paradigm shift in the way that people heal. And I think that hypnosis will be far more central than it has been in its long history.
Yes, well, that's beautiful, Roxanna. Thank you so much. And it's been a real pleasure to have this conversation with you, as you mentioned, from the other side of the world. And so grateful to have your contribution so that together we can do our little bit to increase the awareness and help in general. So thank you so much for your contribution.
Thank you, and I am grateful for the opportunity, and I appreciate what you're doing more than you know.
That's beautiful. Thank you.
Thank you.